Electronic health records, a promising solution. You as healthcare providers may already be somewhat familiar with electronic health records. Before I describe what they are and why I think this is a promising solution, let us talk with Melanie Mabry, a nurse practitioner and a person who experienced just recently the confusion over the use of health information as a patient.
So a couple of months ago I went to see my nurse practitioner that's my GYN, and just for a regular checkup. When I got there, I had checked in online at home the night before, had included an update of my home address, telephone number, and made my co-payment at home to make things easier when I checked in. Yet when I checked in, I still had to give them my home address, my telephone number, my insurance information. They gave me a form to fill out. I took that upstairs where I was going to be seeing the provider, and the form actually involved writing out everything that had happened since the last time I had seen my GYN. Well, all my health care is provided within the same health system, and over the course of the past year I had had a surgery, had had several visits to my primary care provider, so all of that was included in my health record that's in that health system, but I had to write it out and take it into the provider, and then she and I went over it and just had a regular visit. She referred me for my annual mammogram, screening mammogram, so I went over to the health system where they do that, and that's still part of the same health system. They checked me in, verified all of my information. I then went to the technologist where they actually do the mammogram, and she had to verify all of my information. I had to give her my home address again, my telephone number. I had to tell her all of my medications that I was on, all of which are in my medical record, and she set up the equipment and got ready to start. Well, the equipment wouldn't turn on, related to the computer that she had put all this information in, so we had to go to another room in the suite where we were, and I had to give her all of the information again, reload it into the computer system, go over my medications again before she could actually do the mammogram. And it was really frustrating because, like I said, all of my health care has been within this same health system. It's all in the system. Why did I have to repeat all of this at multiple different encounters when it was all there? I'm wondering, how can our system be at that level that it can't know what's going on with the person, that they can't generate something to help out to the patient that's being seen so that they're not having to go over this. I'm a provider and understand it. I can only imagine how frustrating it is for the patients that are also having to go through this, that don't understand our system.
As a healthcare worker, you'll need to understand the importance of the movement from paper to the electronic health record. $19.2 billion of the stimulus package funding have been allotted for health information technology. The overall goal is to create a nationwide health information infrastructure that enables electronic health information to be recorded, shared, and utilized in a way that improves health. Political leaders and healthcare providers are attempting to address issues of quality, access, efficiency, and affordability. The electronic health record is one solution. The electronic medical record, known as the EMR, is the legal record maintained by inpatient and outpatient healthcare facilities on what happened to a patient during encounters within the facility. If we are to reap the full benefits of real-time, online information access, we also need strategies that will not only make the EMR universal, but it will also take us to the next level with the creation of electronic health records, also known as EHRs. The EHR is designed to provide online, real-time access to patient medical records that encompass multiple health care facilities over an extended period of time. The potential benefits of a national EHR system are numerous. I would like to mention a few. First, it creates a single patient-centric view of electronic health information that shows a lifetime record, updated and validated by multiple sources and organizations. Another benefit is providers will be better equipped to avoid potentially harmful and costly drug interactions because they have access to a complete medication history. Let's face it, patients use more than one facility and can be covered by more than one health plan. With today's mobile society, providers need access to health information from anywhere at any time. A nationally networked EHR system would assure access to a patient's medical history during emergency treatment that is outside of their normal coverage area. So where are we today? America's healthcare system is flooded in technology, from digital diagnostics to advanced drug therapies. While diagnosis and treatment methods have advanced rapidly through the use of technology, the application of information technology within healthcare has lagged behind. So what will it take? There are several key elements that must come together if we are to achieve an effective EHR system across the United States. Another essential element on the path to a national EHR system is the creation of a web-based universal gateway that supports all facilities. The other key element will be protection of patient confidentiality and privacy. The industry must establish security and access protocols consistent with HIPAA guidelines. Imagine the future. Any provider can access pertinent patient healthcare information regardless of the patient's location.
If I had access to electronically to everything that had happened to my patient within the time period from the last time I had seen them, or it was a new patient and I had access to their entire medical record since they were a child, it would make taking care of that patient so much more efficient. Instead of spending time reviewing data and getting information from the patient about all of the events that had occurred to them, I could just go over it and spend time actually taking care of the patient and meeting their needs at the time. That's what it's about, is having a record that will allow me to take better care of my patients.